A 73-year-old, well-educated woman is brought to the physician by her daughter, who has become concerned about her mother's behavior. The mother used to volunteer at the local library shelving books, but began to forget where the books went on the shelf. Recently, the mother was found wandering in the grocery store parking lot. In addition, she often forgets to turn the stove off after cooking her family's longtime favorite dishes. What is the most likely diagnosis? This history is consistent with Alzheimer disease, which is characterized by loss of short-term memory and general preservation of long-term memory. There is an insidious progression from forgetfulness to having visuospatial defects and decline in executive functioning. How are the causes of dementia classified? Dementia is often classified into reversible and irreversible causes. Reversible causes include major depression, hypothyroidism, vitamin B12 deficiency, normal pressure hydrocephalus, and chronic subdural hematoma. Irreversible causes are vascular dementia, Creutzfeldt-Jakob disease, Pick disease, and Lewy body dementia. What are the likely gross pathology findings in this condition? Neurofibrillary tangles and amyloid plaques are commonly seen on autopsy. Neurofibrillary tangles are intracellular aggregates of hyperphosphorylated tau protein. Amyloid plaques are extracellular deposits of amyloid beta protein. A high degree of cerebral atrophy in the frontal, temporal, and parietal regions is also present. What risk factors are associated with this condition? Advancing age and a family history of Alzheimer disease are two well-known risk factors. Additionally, because the amyloid precursor protein, APP, is located on chromosome 21, patients with Down syndrome, trisomy 21, have increased APP levels. These patients often develop Alzheimer disease at 30 to 40 years of age. Presenilin 1 is located on chromosome 14 and is noteworthy for its association with early-onset Alzheimer disease. Abnormalities in this gene result in increased beta amyloid accumulation. For familial cases, there is an association with alteration in the ApoE4 and increased risk in developing Alzheimer disease. ApoE are proteins found on the surface of the chylomicrons that are generated by endoplasmic reticulum of the enterocytes found on the small intestine. What biochemical mechanism is likely involved in the pathogenesis of this condition? A preferential loss of acetylcholine and choline acetyltransferase in the cerebral cortex may play a role in the development of clinical disease. What is the treatment for this condition? The acetylcholinesterase inhibitor class of medications, including tacrine, donepezil, rivastigmine, and galantamine, have been shown to slow the progress of memory loss. Memantine, an M-methyldiaspartate receptor antagonist, may protect from Alzheimer disease by blocking the excitotoxic effects of glutamate, independently of the effects of acetylcholinesterase inhibitors.